Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to be covering the thyroid. So the thyroid is another endocrine organ, so it's producing hormones, and it can be found in the neck. So if this is, your eyes would be kind of up here. This is your face, your ears, your mouth, and then in your neck you have your trachea, so that's kind of drawn here in white, your trachea, and this is what you breathe through. So this is like your breathing tube, so you would breathe in through here, and then around your trachea in your neck sits your thyroid in red here. So again, the thyroid makes hormones, so it's again a gland, and the hormones that the thyroid makes are T3 and T4, and their exact names are triiodothyronine and thyroxine, but you can just remember T3 and T4. And these hormones are responsible in regulating metabolism. So you can think of metabolism as how your body manages energy. So when you eat food, your body can either turn that directly into energy, and you can use this energy to move your muscles or breathe or what have you, or you can also turn that food right into storage. So this would be things like, your belly fat, or, your muscles can also store food energy as well to be used later. And so metabolism balances this need of energy and the storage, and it can even convert or tell your body to convert between energy and storage. So you can think of this as kind of fat stores, and you can think of energy as kind of muscle movements. There are other things that would use energy as well, like even just thinking, using your brain would be using energy, but you can think of it as energy as kind of movement, and storage is, generally speaking, stored as fat. And so these hormones, if you have really high levels of T3 and T4, it pushes your metabolism towards using this energy. So T3 and T4 push in this direction. And of course, the opposite is true. If you have really low levels of T3 and T4, your body tends to move that energy or food energy towards storage. So again, this brings us back to this concept that we've come back to over and over again in endocrinology, which is homeostasis. So having enough energy to do the things your body needs to do is also part of homeostasis. And so the thyroid regulates homeostasis through metabolism. So there are also diseases associated with the thyroid, and the two most common are hypothyroidism and hyperthyroidism. So we'll start with hypothyroidism. And again, this is another scary medical term, but we can break it down. So an ism just means a disease. So any sort of ism is a disease. We have the word thyroid in it, so we know that it's a disease of the thyroid. And we have this term hypo, which means low or low levels. And this comes back in a lot of diseases. So hypothermia, for example, hypo being low and thermia being temperature, so low temperature. Hypo is often used in naming diseases. It just means a low level or low activity. So hypothyroidism is low activity of the thyroid, and it's of course a disease. So in other words, this means that the thyroid is not making enough T3 or T4. And you might be able to imagine what the symptoms are from this. So you have not enough T3 or T4, so you're going to have too much storage and not enough energy because there's too little T3 or T4. And so you're going to have very low energy, so you're going to feel tired. You're not going to have very much energy to do anything. You can also imagine instead of using all this food or storage as energy, you're going to convert most of it to fat. So you're also going to put on weight. And converting food and storage to energy creates a lot of heat. This leads to the production of heat. And so if you aren't using this energy, if you're not making a lot of energy, you're going to be very cold. So these people are often quite cold. They're usually a little bit on the heavier side, and they're usually very tired all the time. So on the flip side of hypothyroidism, there's hyperthyroidism. Hyperthyroidism. And again, we know this is a disease because it's an ism. We know it's a disease of the thyroid. And instead of hyper means too much or high levels. So hyperthyroidism is the thyroid is making too much T3 or T4. And so you're going to have really just the opposite symptoms of hypothyroidism. So you're going to be high energy. And in really bad cases of hyperthyroidism, you might have someone who has so much energy that they're almost shaking. Their muscles are just constantly moving. They have so much energy. They'll often be quite skinny. So they'll have trouble putting on weight. They'll eat a lot and they won't gain any weight. And they'll often be quite hot. So they'll be running pretty hot again because they're converting all of their food and storage into energy, which generates quite a bit of heat. So hypothyroidism and hyperthyroidism can cause issues during pregnancy as well. So you can imagine that this energy storage homeostasis is important balance to have during pregnancy, and having a baby or growing a baby uses a lot of this energy. So having too much or not enough can cause problems. So often you'll have issues with the placenta. And we'll do another video on placental abnormalities, but you can have issues with the placenta. There's often increased risk of stillbirth, so the baby is just more likely to die during the pregnancy. There's also increased risk of preeclampsia and preterm delivery. So all of these complications during pregnancy are associated with hypothyroidism and hyperthyroidism. So you do want to be aware of these issues if you have a patient with thyroid problems, but this is quite rare to develop spontaneously or randomly. So in the case you have a patient with these thyroid problems, they need special care.